Hi class, welcome to chapter 11 in your fourth edition for textbook for CDH. We're going to be talking about service learning, and this will give us a nice introduction into next semester for CDH and your actual service learning projects that you will be completing. So, these are our learning objectives for today. We're going to discuss what service learning and experiential learning is, clarify some of those stages of service learning, discuss the benefits of service learning for interprofessional collaborations, some of those interprofessional strategies, and talk about some risk management in relation to service learning projects. So, what is experiential learning, anyways? It is an umbrella term that refers to various models of learning in which experience, now you can see why it got its name, governs the educational process for the student. This is also known as practical learning or real world learning. It's hands-on experience. So as you can already tell when you read the definition of this, we do a lot of experiential learning within dental hygiene programs because you learn about a lot of things in classroom settings, and then you go and you implement them and use them in clinic. CDH is the same. We want to take a lot of the things that we have learned and some of those critical thinking skills that we have learned throughout this course, and we are going to use them in a hands-on experience with your service learning projects. So, experiential learning, also another example of it taking place in authentic settings, is like a WIC facility. But when it comes to your different ideas on some of your service learning projects, this experiential learning can be taking place in any settings, really. It all depends on what your objectives are and what your goal and your mission is for your service learning project. So what would a chapter in CDH be without guiding principles? So we have some experiential learning outcomes that give us some guiding principles. These are good to know for your exam. We want to connect classroom learning with authentic situations. We do that every week in dental hygiene school. Continuously reinforces that learned knowledge and skills through those practical experiences. It challenges the student to think critically in addressing real needs. Again, you do this already in clinical practice. Increases the aptitude for teaching various populations, right? Because it gives you lots of learned experiences, and enhances the skills of the dental hygiene workforce. So service learning and your service learning project have a lot more real world experience when you get into the dental hygiene workforce after you graduate and you pass your clinical and your written boards and you become licensed, that these skills are going to go far beyond what you learned in school. And there are things that you will learn now and that you will experience that some of it you just kind of absorb and you don't really think about, or it doesn't seem important in school. But when you get out and you're working, there's lots of things that will come back to you. Sometimes you'll notice and sometimes you won't. But they do help enhance you as a dental hygienist, as a licensed healthcare provider. So we have some learning methods whenever it comes to experiential learning, right? We've got those methods. Again, what would we be without our guiding principles and our methods in CDH? So there are a handful of things that come along with experiential learning. And you experience most, if not all of these throughout your dental hygiene education. So you have community service. You have a requirement for community service for grad requirements. Many of you have been working, especially with Ms. Ficken, with those. This provides you with that service to the community and that primary focus on the community needs. these community service experiences will also help you when it comes to your service learning projects, because sometimes when you're out working in those community settings, you notice and realize and see some of those needs that the community may be lacking, or places where you could help fill in even the smallest of gaps. Then you have clinical rotations. This we do not specific outside clinical rotations, but you have clinical rotations every single week in the clinic. So again, you take that knowledge and you apply that expertise and knowledge and the skills that you learn right in the clinical setting every single week. Then we have a practicum internship, which is typically longer sometimes than like a clinical rotation. And this may be, it can be a little different. Practicum and internships, though, I think this definition is a little outdated in saying that it's longer than a clinical rotation, because that's not always true. Like next semester in CDH, we will have some sort of practicum internship type of requirements where you're going to be at least witnessing or viewing some of those different scenarios that we've talked about all semester, so that you can witness those outside of the typical box of dental hygiene practice. And that makes you, no matter what dental hygiene setting you go into, that makes you a stronger, more skilled dental hygienist when you get into the workforce. Volunteerism, this often can come along with community service, but whenever we're talking about volunteerism, this also can be in specific places like volunteering with oral cancer screens and things. So community service and volunteerism go very hand in hand with each other. Then we have service learning, which we are going to focus on obviously this chapter, and is going to be a big focus for next semester. And this is where you participate in a teaching and learning method that stresses that collaborative planning and implementation of projects. Right? And so we're going to walk through those projects in your community service or your service learning projects and create objectives and a plan and a strategy, create your evaluation plans, and we will get more into that next semester, but we're going to continue on to learn a little bit about it now. And a lot of the things that we've talked about in class already are the same strategies that we are going to use for your service learning. Now, I know a lot of you, and we've discussed this in a class discussion, have a lot of great ideas for service learning projects already. But here are some other ideas also. And sometimes whenever we start with our service learning project ideas, we may begin with one idea, and then we may help transform that into something slightly different, but that is looking for the same outcome or has the same goal or mission in mind. So you do not need to know these guiding principles on ideas, but these can be helpful, especially if maybe you find that the project that you initially wanted to do maybe isn't feasible, or you can't find someone that wants to collaborate with you, or they're unreliable. So this way you can maybe take the same idea and tweak that a little bit to be something that's actually doable for your project, especially having somebody that's reliable. Sometimes you have a great idea and nobody calls you back, and it's very frustrating, but it happens. And so then we run with that idea and we tweak it and we find a different way to do it, or we find something else within that idea that we can alter. So when we're talking about service learning, and we've talked about objectives, but we are definitely going to be talking about and creating some learning objectives next semester. But one thing with service learning is that you have some specifics to your objective. So you have a service objective plus a learning objective that then creates your service learning objective. So the service objective is a statement of need articulated by the community partner. So this may be the organization or an individual that you are going to work with to complete your service learning project. So the partner may express a need, and the dental hygiene students are positioned to be able to provide that need and a service, as opposed to what the student may assume is needed. Right? So this is where I was just talking about sometimes what we view or think that our community partner may need may not actually be what they perceive is that they need. So we want to make sure that we're communicating with them and talking with them to make sure that we align with each other. Then the learning objective is focused on the dental hygiene course learning objectives, and you will have a list of those whenever it comes to next semester. They'll be very similar to this semester's, but you will have those, and I will help you find them if you cannot find them. But these learning objectives are what require that higher level of thinking as opposed to memorization. And they're more effective for service learning experiences. So we can look through those dental hygiene course learning objectives, and that can also help guide us in creating the service learning objective. And then, of course, we're going to have some specific objectives for your service learning project in general. And some of you have already started creating those, and we can build upon those next semester. When I say some of you, I actually mean all of you, because you all did that in a discussion this semester. So what about the steps in our service learning process? We always have to have steps to things, right? Guiding principles, methods, and steps and processes. So first off, we need collaboration because we're working together to accomplish a goal. That's the definition of collaboration. And we want to make sure that we're effectively collaborating with that community or organization that we are working with for our service learning project, right? That comes back to those service objective. We don't want to assume, we want to collaborate. Then we have orientation. And orientation within our service learning process is going to help minimize disruptions. The student and the institution, the individual, the organization that you're working with are going to want to become familiar with the plan or the program. Then we have preparation. This is the very similar processes that we have talked about all semester, and we will review them and go over them more next semester when we are in the midst of creating your programs. But these are the same program planning skills that we've talked about in numerous chapters this semester. You do not need to know all of those right now because we already have reviewed them in previous chapters. I believe it was like chapter 3 and 6. But don't quote me on that, I could be wrong. But we will review and use those program planning skills and methods whenever you're creating your service learning project or program next semester. But this also includes things like brainstorming. We want to identify different roles. We want to create an action plan, have a timeline, things like that in preparation. And there's one other thing in preparation that can be very effective, and that's risk management. And we're going to talk about that a little bit more in depth on the next slide. So then we also have reflection. And this is deliberately drawing the meaning from the experience. We want to connect our objectives and our learning experiences. So reflection can happen throughout the process, but it also happens often during the evaluation phase at the end. And we know that evaluations are a continuous process, and we can divide those into two phases. We have formative evaluation, which is when we're examining the project while it's ongoing. Think of like formation. So sometimes our evaluations, formative evaluations too often can happen and kind of coincide with your project, right? As you learn, as you discuss, as you collaborate with your organization or individual, you may discover like, well, as I evaluate these things as we go, I want to change this or adjust that. Then we also have the summative evaluation, which is at the end of the project. And that's whenever we really take everything in as it happened and the way it went, and we create an end product review of our project. So summative, I think of like a summary or a conclusion, right? It's at the very end. Informative can happen and be ongoing during the project and the process itself. Now, when we're preparing, an important element that we haven't talked about this semester is risk management. So risk management is really managing the possibilities, right? So we want to make sure that we have alternative plans in the case of possible problems. This also can be viewed as like a contingency plan, emergency plan, an incident plan, a what if plan. There's lots of different names for these. And risk management, as a definition, is the formal process by which an organization establishes its risk management goals and objectives, analyzes its risks, and selects and implements measures to address its risks in an organized fashion. So, we know that we may not be able to know all the risk that may come along, but one of the things whenever we are dealing and implementing our service learning programs is that usually we are traveling, we're going someplace that maybe we haven't spent a lot of time. And so we want to make sure during our preparation phase and planning that we know what our goals are and that we are also communicating with our organization or individual. That's a great way to manage risk. But we really want to avoid problems, right? We need to plan ahead. We need to know, do we need to bring certain equipment with us? Do we need to make sure we have a certain software? Like, depending on the project that you are implementing, we just need to make sure that we are working on risk management and taking that into consideration. And a lot of that will come out within the planning process while we're preparing for our program. And I will help you with that. Your classmates will help. You will help each other also. Because sometimes we may, as we know, we all have different experiences. And so we might kind of have a heads up on something that could go wrong. Or just think of something. Maybe we've had that something happen to us and go wrong. So we really just want to avoid those problems. So why does service learning even matter whenever within your dental hygiene education, right? Why does this matter? Maybe you're thinking, I don't want to go into public health. This isn't an interest of mine. I just plan on going and working at a dental practice. That's what I've always envisioned. That's what I know that I'm going to enjoy. So why does this service learning project even matter to me? And the reason being for service learning and why it's important is because it helps create and enhance those interprofessional collaborative practice skills. Because these are skills that are going to be required by health professionals, and you are a health professional when you enter the workforce. You need to be ready to integrate into teams of different healthcare professionals, whether that's within the same organization or that's you sending referrals or having to communicate with other healthcare professionals. And it's really for the purpose of cooperating to achieve the best health outcomes for patients and communities, right? So interprofessional collaborative practice is a skill that is important no matter what setting you are working in. And so that is going to help you in all settings. And that's why service learning is important. The other thing with service learning is that the integration of oral health into settings that aren't just your traditional dental practices, like standalone dental practices, is definitely evolving. And there is a lot of support and promotion and work towards creating a more integrative health system in the United States and in other countries also. And we know that, right, through a lot of these different organizations and entities that we've talked about all semester. We have the Healthy People 2030. We know oral health integration is throughout Healthy People 2030. There's a specific health indicator, right? Remember, that's directed straight at oral health. Then we have that Association of State and Territorial Dental Directors, the ASTDD, National Maternal and Child Oral Health Resources Center, the WHO, ADIA, ADHA, the list goes on. So oral health integration is something that is definitely has been progressing over the decades, and it's only going to continue. So that interprofessional collaborative practice is going to become even more important. I would love to see that private dental practices are integrated and working within medical practices, right? So this doesn't just have to be a public health kind of view or scenario. It would be amazing if with time, and hopefully in the near future instead of the far future, that, you know, like a dentist and a dental hygienist and a dental assistant can work and be working with collaboratively in the general doctor's office, right? Which we know would be benefit our patients tremendously, because not only would they see us, but they would also have access to their general physician on a more regular basis, because we know they come and see their those that use the dental system and oral health systems often see their oral health care providers more often than their general providers. So you could help bridge the gap for those that maybe need to see their general physician more often, and vice versa, those that don't view or even know the importance of oral health. They don't understand it, they haven't grown up around it, it's not reiterated, you know, within their family, their friends, their community. So if they go to their primary care provider, their physician, general physician, their doctor, however you want to refer to them, and there's a dentist and a dental hygienist and a dental assistant, or just a dental hygienist within that facility, then, you know, working together day in and day out, then you have a really seamless process to get that oral health care and education to patients that normally wouldn't even think about it. So that is another example why your service learning projects and programs that you create are going to be extremely beneficial for you throughout your career, whether you are in private practice or public health, or you're working for an organization. It just really helps to create those collaborative skills. So we have some core values and principles that help us be effective interprofessional collaborative teamwork. And when you read this list, it probably seems pretty obvious, most of these. As far as values go, we have honesty, discipline, creativity, humility, and curiosity, right? We're curious about what's happening. We want to try something new. And principles are shared goals and clear roles, mutual trust, effective communication, which can be a challenging one, and then measurable processes and outcomes. Especially if we're creating something that's new, we need to be able to measure those processes and outcomes. But that's true in any program, but if you're trying to implement something that's new and different, then we even more so need to be able to measure those processes and outcomes, because we are going to be tasked with proving that it's beneficial, that it's workable, that it's financially feasible, and all of those different categories. So when we're talking about integrating public health, right, or integrating within private practice settings, we have a lot of public health resources that can help us. And these are good resources while you're creating your projects too. And I've said this many times throughout class, we do not have to reinvent the wheel, right? That's indicative throughout our entire chapter. Almost every chapter we cover and resource we talk about in CDH, we talk about how those resources are there. We don't have to come up with these new methods, with these new screening tools. They're there, they're tried and true. We can take them and we can adapt them if we need to, if they don't quite suit us. But these are some examples of public health resources. We have Healthy People, state and local oral health programs, the ASTDD, of course. They're always giving us long lists of processes and steps to do. That National Maternal and Oral Health Resources Center again, the Centers for Disease Control and Prevention. And I think if you look at this, you'll notice there's a similarity in those supporters of oral health integration, right? There's a reason that they've provided these resources because they look at the data, they look at the research, they see how programs have helped communities, how they've been beneficial. And so they've created these resources to help other programs and communities be successful. So lean on these resources whenever you are creating your programs next semester. So you'll be happy to know that that's the end of this chapter on service learning. One of our most short chapters this semester. So of course, reach out to me, text, email, phone call. Let me know if you have any questions. Make sure you complete your worksheet, which will not be a lengthy one, and then we will have a quick exam on this, or last one of the semester.